There are two takeaways from this piece of research.
Hello, Dr. Joe here, sitting right here at the bottom corner of your screen. So in today's video, what we're gonna do, we're gonna be answering this very question here. Does cholesterol matter in young people? Okay, does it matter? Does having high cholesterol level send you to an early grave? We're going to examine that in this very presentation through the prism of this study here that was published in the New England Journal of Medicine with the title Serum Cholesterol in Young Men and Subsequent Cardiovascular Disease. So let's look at the study design. What the study authors did was they recruited 1,017 young medical students in the Johns Hopkins University, and it was a longitudinal study because they followed them up for 30 solid years. Okay, 30 years they followed up these young medical students who were at the Johns Hopkins University, young men who were in their 20s. And the other thing they did was they measured their cholesterol level on several occasions while they were in med school. Okay. So they wanted to see the pattern of cholesterol levels that they had whilst they were still in the medical school. And after graduation, they followed them up annually, asking them if they had developed any cardiovascular disease. And that was how the study lasted for the 30 years. So let's have a look at their results. What they found was that high cholesterol level at the beginning of the study meant a higher chance of the following: any type of heart and blood vessel disease, so any cardiovascular disease. So this could be stroke, or it could be any other peripheral arterial disease like intermittent claudication. So yes, a high cholesterol level at the beginning of the study meant your risk of developing any cardiovascular disease went up. Also meant that specifically your risk of having a heart attack went up as well. Okay, your risk was raised. And also your risk of dying from cardiovascular disease was also elevated. The fourth finding was that your risk of dying early before you got to the age of 50 was also raised. Okay, so these were, the main findings. um Here's the other thing. Because when it comes to population-based studies where you're following up people for a long time, there are confounders that could influence the result. And the study authors here did a very good job because they adjusted for all of these confounders. So, confounders like weight, exercise, coffee intake, smoking changes, diabetes, and high blood pressure. So, they adjusted for all of these confounding variables. Even after adjusting for all of that, guess what? They also found that the link between initial high cholesterol level and heart problems or risk of dying early remained strong even after adjusting for all of this. Okay, so it's pretty compelling, the findings here. And the study authors concluded, and I quote, that these findings indicate a strong association between the serum cholesterol level measured early in adult life in men and cardiovascular disease in midlife. Okay, so this was the conclusion that the study authors reached as a result of this very study. So please do not listen to people who tell you that cholesterol level doesn't matter. So anyway, in the course of this presentation, we need to go back to the original question: does cholesterol matter in young people? Well, the answer to this very question is yes, it does. Okay, yes, it does, because what they also found in this very study was that a difference of 36 points in cholesterol level was linked to a 72% higher risk of cardiovascular disease. Okay, so a difference of 36 points in your cholesterol level from baseline was linked to a 72% higher risk of cardiovascular disease, and also a 101% higher risk of coronary heart disease. And it is the coronary heart disease that will make you have a heart attack.
So, there are two takeaways from this piece of research. The first is that looking after your cholesterol is super important. And it is not something that you should ignore, regardless of what you may have heard from other quarters. That's the first takeaway. The second takeaway is that the person who had a heart attack this week, the heart attack did not start this week. The events leading up to the heart attack started years ago, okay, several years ago, which brings me back to the very first takeaway. And that's the fact that looking after your cholesterol is super important, even if you're young, okay? So please do not ignore your cholesterol levels. Anyway, hopefully you got some value from this very video. Do let me know if you are looking after your cholesterol very well. Just say yes, please, down below. And if you're not, say no. It doesn't matter. I just want to know, okay? So hopefully you got some value from this very video. If you did, please give the video a thumbs up. Please like the video and leave your comments down below. I will see you in a couple of days. Dr. Joe here.